Welcome to Nurture KC News. This is the podcast presented by Nurture KC, and I am Tracy Russell. I serve as the CEO here, and we are an organization committed to reducing infant and maternal mortality in Kansas City, as well as Missouri and Kansas as a whole. I'm excited for today's podcast. This is probably my favorite topic of the podcast that we do during the course of the year, because this involves our legislative work. And I am a strong believer that following what goes on in the legislative process has a disproportionate impact on maternal and infant mortality in these states, and that it's really a critical function of what we do. And I'm delighted this year to welcome both our Missouri and Kansas lobbyists. Sean Gatewood has been with us for 3 sessions now. And Chris Roepe just joined us this past year and definitely hit the ground running, as we had a very pressing issue that we'll talk about here momentarily. So with that, I think we'll begin with introductions from both of you and just kind of explain your background and interest in our issues. So Sean, why don't we start with you?
Sure. Tracy, again, my name's Sean Gatewood. I have been with Nurture for 3 years now. I've been around the Kansas State Capitol. I think this is going to be my 18th or 19th session in a variety of capacities. These days, I largely focus on health and public safety, representing a variety of interests around the Medicaid program and public safety type stuff and these sorts of issues. But I've been the executive director of a statewide health organization. I served in the Kansas legislature for 4 years, graduate of Fort Hays State University. That's kind of been my intro into politics in the Kansas State House.
And Sean and I go back decades now, believe it or not. I first met Sean when he was a legislator and was trying to get a statewide clean indoor air passed. And I will say he gave me a hard time during that, even though he was with us on it. And after we had gotten that through, he had commented that I was quite persistent, which I've heard more often than not over these years. So it's great to be on the same team, though. Chris, why don't you tell us a little bit about yourself and how you came to join in working these issues?
Sure. Thank you very much, Tracy. As you said, my name is Chris Roepe. I am your organization's eyes and ears on the ground every day in Jefferson City, and my first year with you, Tracy. I've been doing this in the Missouri political and public policy world for, I guess, since 2002 is when I first started, and spent all time, many years as chief of staff to the majority floor leader and the president of the Missouri Senate. Is kind of how I got my start and things, and have been at my lobbying firm now for 10 years. And have worked a lot on a whole host of healthcare issues over that time, specifically with hospitals, Medicaid, and about any other thing you can get related to the healthcare space, especially with some of our allied healthcare providers like physical therapists, nurse anesthetists, dental hygienists, just to name a few. And I've really enjoyed working on the issues that are near and dear to Nurture KC.
All right, thank you. And I will say, just in terms of having a presence in the State House and particularly having someone on contract is just so very important to what we do. And what I look for when I'm considering who would be the right person for us is, one, do they believe in our issues? You know, this is not transactional work, that's for sure. 2, do they have a great understanding of that legislative process and thereby strategy? And 3, do they have significant relationships in that state house? Because what you're really looking for is access to the right people and lobbyists who understand the different personalities, because the system is set up to not allow much to get through. It truly is kind of a checks and balances. And so making sure that you have the appropriate person to do that is really what I look for. And as an organization, it's my job to be on top of kind of the ins and outs of the policies that we're pursuing and to be able to convey that to the contract lobbyists so that they can utilize that going forward. Okay, so Chris, we're going to start with you. We really hit the ground running very quickly this session. And it's interesting because we develop our legislative agenda. This one actually wasn't on the list, but we saw an opportunity and it quickly moved to the top of our list. And this really affected us organizationally. We used to have what's called a fetal infant mortality review program at Nurture KC. And we had that program for 20 years. We were considered a national model, or FEMA for short. And what that function was an opportunity to look at infant and fetal deaths in Kansas City with a clinical team, with a community team, and identify trends that were leading to those deaths, and then coming up with actions and strategies to mitigate those deaths. And because we had such a successful program, the state of Missouri in 2024 decided they would like to see this implemented statewide, which is great. We have no qualms with that. And so during the course of that 2024 session, they were able to get statewide FEMA, but also included in their budget request to do that was that Nurture KC would remain as either an independent FEMA for Kansas City, or we could join their efforts and play a significant role. Well, as this kind of played out in the ensuing year, we were left without being able to participate as an independent FEMA. And what we were seeing was a real delay in terms of cases getting reviewed as the statewide effort was trying to get up and running. And we felt there was a real gap and that we didn't have a good handle anymore on what was driving infant deaths in Kansas City. So to that end, Chris came into the picture. I told him I wanted to try to get us reestablished. And I think his comment was, well, let's do it. So Chris, why don't you just kind of talk us through what that process was and the support that we found?
Sure. So this is something, at least in the state of Missouri, done through the budget process. Previous governor saw this and his department saw this as a big priority, as you mentioned, to want to do this on a statewide basis. And then what you had done for the past 2 decades, and then not being able to continue to do that. And like you said, a huge gap in gathering that information to be able to use that to help improve health of those moms and babies in the zip codes that you serve. And we really undertook a massive educational effort with policymakers. And I think to your comments earlier about knowing the right people to visit and get in the doors with, and then bringing the expert, getting you into the room with us. We're smart enough as lobbyists to know what we don't know. And by the end of it, I definitely was able to regurgitate all the points and information and be very knowledgeable on this topic, but definitely gotten there without all of your wonderful educational work that I've witnessed you make with legislators and myself. One of the key parts to being able to get that funding restored is we do have a lot of strong female legislators in the Republican Party in Missouri, and much like Kansas, it's very legislature use is very red here. And so having some folks who are female in key committee chair positions and key positions on budget, even on both sides of the aisle, was certainly very helpful to get them to understand that there was this gap and there was a need to get this up and going again. And the last thing that I'll mention, I think that was a really big selling point for policymakers, especially going into tough budget times that we started to see this year in Missouri with the way the budget played out, and definitely to see next year in the coming years, is willing to put some of your local resources into this effort. And so you essentially had a private public partnership of what I would call local funds versus what the state is willing to put in. So the state is going to get all this coverage at essentially half the cost of what it would if they did it themselves. And that is something that has really worked with legislators and policymakers in Missouri the last several years. We saw a lot of federal money come down from DC in various areas of state government. And I think that message worked really well with legislators. And we got budget chairman in the House on board and was able to get that implemented in through the House part of the budget process and maintained and held that funding Senate side. And then the governor obviously signed that into law last week. He made his final budget recommendation for the end of the fiscal year.
Yes, that is great news. And thanks for raising that point. We definitely had skin in the game with this in terms of being willing to cover part of the costs of this internally. And it was really my feeling from the start that there was a bit of government overreach, that we were an independent program that brought the expertise for this and could easily keep it going and resume it as we're now in a position to do. So that was a huge win for us in Missouri. And I think just a recognition that those folks who are on the ground and most connected within their communities are often best situated to handle this kind of work. So one other issue, Chris, that I wanted you to comment on before we move over to Sean, and you touched on it a bit in terms of this cooperation among lawmakers in Missouri around maternal and infant health, particularly with our women lawmakers, that really has been bipartisan in nature. And they are tackling some issues that are very meaningful, but that are difficult to get through when you look at who some of the opposing side might be. I wanted to talk about one bill in particular that Representative Peters carried through the process. And that was what we're referencing as a maternal omnibus bill. There were 4 key provisions to that I wanted to touch on. The first is it requires insurance companies to cover as a benefit blood pressure tests for pregnant women. And this is particularly important because we know that heart disease is the leading cause of maternal mortality for Black mothers. And so recognizing that and providing what should be a very useful benefit that is universal in scope, this isn't just going to apply to one program versus another, I think is so important in continuing to build support around these maternal health issues. The second is allowing the prescription for contraception up to 1 year. Often women might have trouble getting to the doctor, particularly in rural areas. And as part of our program's work, we do focus on appropriate birth spacing as key to both mom's health and the baby's health. So I think that was a huge step in the right direction. In addition, I know that Senator Washington for several years has wanted to take a deeper look at our pregnancy-associated mortality review board in Missouri and really disaggregate the collection of that data by race so that we get at, okay, what is the impact to Black mothers compared to white mothers? As we know that the death rate for Black moms in Missouri is about 3 times that of white mothers. So getting at more of those root causes should result from the expansion of the PAMR umbrella, so to speak. And then finally, within the bill, the Department of Health and Senior Services can adopt a food as medicine program whereby a physician could write a prescription for nutritious food. And as we look at some of these preventive issues around health, I think that one is so important. And it's one that we actually currently do at Nurture KC. We work with University Health. They provide fresh produce to our participants on a weekly basis. It's called Food Pharmacy. And so seeing programs like this kind of turned into our programs statewide is really what we love to see. So I think all of those are a recognition of the needs that we have, and it's in a response to those. So Chris, can you talk a little bit just around how you think those issues have come to the forefront for this particular group, and if you see this as something that we can continue to build on?
Yeah, the legislation that you're talking of, a care bill, of a lot of issues that have been vetted over the past several years. It's some of them, and the ones that you mentioned specifically in the maternal space, were new this year. But I go back to looking at such strong female lawmakers that we have here, especially on the Republican side of the aisle, really made many of these a priority, and were able to push them and to get them included into this legislation at the end of the day as it went through all the different changes. It's always a battle when you're up against the insurance special interests who fight many of these issues. But again, these were priorities to lawmakers that were wanting to do whatever to get these into this omnibus healthcare bill. And I do want to mention Senator Washington's leadership as well. She did a great job. I know this has been important for numerous legislative sessions. She has some really good ties, not just to her urban district that she represents in the Senate. She's got significant ties to some rural parts of Missouri as well. These are statewide issues and how they affect moms and babies, but it would not have happened without her being such a champion for these, especially on the Democrat side of the aisle here in Missouri as well.
Yes, I totally agree with that. And it seems like there are fewer and fewer issues where you see kind of that bipartisan coming together. And this has definitely been one of those that's been great to see. Okay, let's pivot to Kansas for a bit here. So we have been leading the legislative effort on paid family and medical leave in Kansas. And we are working within a coalition called Paid Leave for Working Kansans. We've already got 2 sessions into this, believe it or not, Sean. I'm sure you feel every bit of it. But what we are looking at is what 14 other states have done, most recently Virginia. And this is giving 12 weeks of paid leave for workers under basically 4 different types of circumstances. So the first, and really what brought Nurture KC into this work, is paid parental leave. So that's for both moms and dads. And for us, it's really a recognition that new parents need that time at the beginning of that child's life to bond with the baby, to take care of their own health needs. And that ultimately, the data shows that having access to 12 weeks of paid parental leave reduces the incidence of infant death. And that's really what has drawn us to this process. In addition to that, someone could take 12 weeks of leave for their own serious illness or that of a loved one's, including elder care, which we think is another extremely important issue that we really haven't addressed well. And then finally, for veterans, they would also be able to take leave upon deployment and reentry. So Sean, I'm going to let you talk just a little bit around what our strategy has been on paid leave and the support we're building and where we go from here.
This is a pretty large piece of legislation. It's a fundamental policy shift, but we have been getting some support from places that originally, I think folks thought there's just no way. Our strategy has been to get in front of and have informational hearings in both House and Senate for the insurance committees and have some very good conversations, including the opposition, around paid family leave. The key with a policy of this sort of magnitude is education. And so we've been kind of going around the state in session and out of session and educating lawmakers on the topic. And sort of the key thing there, again, as mentioned earlier, this is a very red state, very Republican led. And that kind of a conservative perspective, I think, sort of lends itself to this policy in particular because of its focus on the family unit. And that has sort of gotten us a lot more support than originally expected. So now we're kind of having those conversations with various members of leadership. Here in Kansas, it's a little bit tough right now because we're in the middle of a governor's race. And then you have kind of the secondary wave after a governor's elected here. They start picking apart lawmakers to pull into cabinet and whatever else. So we've got some unpredictable things that are kind of headed our direction. But that's sort of what we've been doing, kind of building a base of support. I'll also say the lawmakers in Kansas, particularly the conservative women that we've talked to, I think they're going to play a pretty strong role in moving this policy forward. Again, that kind of focus on the family has been the key point. So, yeah, that's where we're at.
Yeah, and I would reiterate that we really have presented this as such a pro-family policy because every one of us will at some point experience some of these life circumstances that drive the need for this. And I kind of jokingly have said in committee that I've actually experienced three of the fourth being that I'm not a veteran. But it seems like we just haven't really adjusted to what people would like. All the polling on this issue shows overwhelming support for this. And we're really trying to make this into a plan that would be targeted to Kansas. It would be paid for by both employees and employers, split equally. So we're not asking employers to pay the full freight on this. And it comes out to about $20 per employee per month. That's it, to get these kinds of benefits. So we are planning on introducing a bill this next session, since we have spent the previous two just educating on the concept, and hopefully we will be off and running. Let's move on to a couple of defensive issues, because we've certainly had our fair share of that as well. So it seems like in Kansas, at least, immunization shows up every single session, and it tends to be one of the deciding factors to adjournment, unfortunately. This year was no exception, and it almost feels like we're at a bit of a press with this right now, considering what's going on at the federal level. There's some renewed energy around questioning both the safety and effectiveness of vaccines, and this is against the backdrop of measles outbreaks across the country, including in Kansas. So this year we saw a bill, didn't get very far. It was introduced in the Senate Health Committee that basically just would have done away with any of the childhood vaccine mandates to get into school. But what we did see was an amendment added to the budget on the House side that would basically make the Kansas vaccine schedule mirror what has been recommended at the federal level by our Health and Human Services Secretary. And that is actually a determination that has been tied up in court to this point because he didn't go through the appropriate review process to institute that. But it would reduce vaccine requirements from current number of 18 down to 11, including not mandating hepatitis vaccines or meningitis vaccines, just to name a couple. And I have viewed this as just this constant kind of whittling away at trust in vaccines, because most of these issues when it comes to policy really are culture driven. That's how you get people to comply. And anything that we do to further cast doubt on the importance of this means that you'll have less people getting this done and kind of protecting the herd, as we count on with vaccines. Sean, can you talk a little bit about what has happened with this over the last few sessions, including last year we saw a bill get through, and what this might mean going forward?
The line item issue that you were talking about in the budget, it was vetoed by Governor Kelly. It passed on the budget, and then the House overrode the veto, but the Senate failed to act on it, so the veto was sustained. So we basically got sort of a buzzer beater. So that was not wonderful. It's just been a steady erosion of vaccine confidence or whatever in the legislature. There's always just some slow picking away at it, including the early childhood bill, not this last session before that, removed some provisions there for admission into early childhood care. So we just kind of keep seeing it. There's been the measles outbreak nationally. That doesn't seem to be sort of playing into this. When I first got into this, the COVID vaccine, we're not talking about that. We're talking about sort of very established measles, whooping cough, this sort of thing that is now constantly under some sort of pressure. And I don't anticipate this upcoming session being any different.
Well, and we've also lost some of our key champions on this as well, with the departure of our physician legislator who was quite important on this issue for us.
Yeah, several of them. I mean, we have had the key opponent went away, but we've had several more On the other side of the issue, we've had some of the folks that would bring the wildest bills, but some of those replacements have kind of filled back in, and we still keep seeing more of this vaccine pressure, even though they've departed. And yeah, we have not been as successful probably in having the physician and whatever else. They were so helpful among their peers. Republicans, again, very conservative folks that were very pro-vaccine and outspoken about it with letters behind their name that meant something. That was very helpful.
Yes, and it does feel like every year what's happening at a federal level is connected to what's happening at the state level. Certainly vaccines, that is the case with that, as well as kind of some of these social safety net issues. This is probably the first session where we kind of delved more into those broader issues. My philosophy has generally been, if it pertains directly to maternal and infant health, that's where we jump in. But at this point, we have really felt compelled to broaden what we focus on. And so that brings me to the next issue, which is last year, federal government passed H.R. 1, which will greatly reduce spending on Medicaid and SNAP. And it also institutes stricter eligibility requirements, work requirements in particular, as well as age requirements. And there are greatly increased administrative costs that will be coming down to states. And to provide some perspective on this, in both Kansas and Missouri, in the last few years, we have gotten through a doula benefit through Medicaid for women, which we know will have a great impact on birth outcomes. In Missouri, they've actually expanded Medicaid over the last several years, and this will impact our birth outcomes going forward. So I know in Missouri, I just recently saw a stat that indicated Missouri will probably have to pay around $150 million more a year for administrative costs associated with these programs because their error rate is too high. And I know Kansas isn't far off that either. Chris, can you talk about just putting that in the context of the state budget and what this might mean going forward?
Yeah, we're definitely already in a pretty rough budget situation that's only going to get worse. Just to throw a few numbers to give it more context for you, fiscal year that just started on July 1st, that is what the legislature passed during this past legislative session. In the state of Missouri, we have to have a balanced budget. And in order to do that, some of the recommendations and the decisions that Governor Kehoe made was to veto about $30 million worth of items that the legislature put in the budget. And then even going forward then into existing programs, withheld funds in a total amount of about $440 million. And so that's just withholding of funds. If the budget picture turns around, he could release that money eventually, but already at the start of the year is withholding those funds in order to be able to balance the budget. The projection of what legislators are going to have to do in next year's budget is expecting a $500 million shortfall compared to last year. You can just look at history to see what typically, at least in the state of Missouri, when there's a shortfall, what does the legislature start to cut first? It's higher education, it's seniors, it's all those really expensive cost drivers that we have. And I would expect that to be no different as far as what is looked at next year. To your point, Tracy, looking at Medicaid eligibility and new coverage and new services, those are just going to be non-starters across the board, and not just in Medicaid, but just in decision items everywhere in state government. But definitely will hurt those that are in our most vulnerable communities and will have a lasting impact if we can't figure out a path forward that makes sense. I know one other issue, because as you mentioned, our voters in Missouri did pass Medicaid expansion several years ago. That is in the Missouri Constitution. And so there would have to be, on work requirements, would have to be a change to the Missouri Constitution to do that. That legislation to put that forward to the voters did not pass in the Missouri legislature last year. It made it through the House and then never made it past the committee process over in the Missouri Senate. So that issue has been around for a very long time. It will be around next year as they try to figure out how to balance the budget. And one of the other big cost drivers that you touched on that I'll just reiterate is on the eligibility verification that is being required from this current administration in DC, and what that means to get those federal dollars, that a lot of resources will have to be spent for our hospitals and others to keep up with and take care of that mandate from the federal government.
Well, and really what we're experiencing now is just the tip of the iceberg, because many of those provisions of HR 1 actually won't kick in until after the November election. So the lights are flashing red from our perspective, and there's going to be more to come. And I'm glad you brought up that issue about the attempt to put those work requirements in the Constitution, and that it was unsuccessful this year. Kansas took kind of a different path to also provide more stringent requirements around these programs. And Sean, I know this was an issue that you spent the majority of the session on, trying to at least ameliorate some of the outcomes. And that was House Bill 2731. Can you kind of talk through what was in that bill to start and then where we ended up?
There was a lot there. The biggest thing, and I'll be honest, I really focused on sort of the heavier hitting parts of the bill. A lot of it had to do with SNAP, and that's not something that I have a lot of familiarity with. It is going to end up putting some pressure on the Kansas budget, I will say, something to the order of $40 million because of our error rate, just to throw that out there. My focus really was on removing the quarterly re-eligibility checks or reapplications, or however anybody wanted to spend that. But essentially, folks would have to go back through the process every quarter, which is pretty overly burdensome to the individual. I mean, these are individuals that are on there, typically have some life circumstances that are already a challenge. And to chunk that in there, particularly with, say, somebody that's got a mental health issue or whatever else. So we slowly ended up getting various populations pulled out and then got the quarterly eligibility check eventually eliminated. There were other things in there about not having new Medicaid programs unless they were approved by the legislature that were to cost some money, and this, that, and the other were a little bit different, and those kind of stayed. And I actually thought those were a little bit counterproductive, because there were instances in which the state Medicaid program can have pilot or whatever else that were frankly encouraged by HR 1, kind of was encouraging innovation. And the legislature said, no, we're going to go a different way on that. So I thought that was kind of an interesting thing, purported to be sort of in lockstep with HR 1, but it went the exact opposite direction. It was odd. So anyway, that's what we ended up with. My eyes have been, as of lately, a little bit more forward, because recently announced there was a interim committee given 2 days. It'll likely be September-ish or so, focused on Medicaid and SNAP eligibility for the upcoming session. And so I don't know what exactly that's going to entail. Haven't quite heard yet, but I'm talking to lawmakers, just trying to figure out where they're looking at going. I don't see any evidence of a whole lot of fraud out there. And we have kind of a stingy Medicaid program. We didn't expand. We have a pretty small program as states go these days. So I don't know what we're after.
Are there now just 9 states that haven't expanded Medicaid, or is it 10?
It was 11, but you counted Wisconsin that was already up to like 100% of federal poverty. And I think Georgia's kind of done something different. This like skinny expansion that wasn't expansion. I'd have to double check that, actually.
But I think certainly in the Midwest, we're about it.
Yeah, we're surrounded. Every bordering state, and probably for a couple of layers. I think the closest state that's not an expansion state at this point is Wyoming.
Kansas and Wyoming. Let's move on. And this kind of brings me to the next point, in that Missouri and Kansas do share a lot of similarities in terms of very Republican state houses. They really do consider themselves citizen legislatures, and that these are not full-time legislatures. They run through the winter and spring and adjourn. But one key difference is Missouri is a ballot initiative state. Kansas really is not, although they will have a ballot measure this year. But Chris, we have several coming up, and I think what I want to focus on here is just what's going to be on the August primary ballot, because we do have a couple of initiatives there that will certainly have an impact on the work we do. So can you speak to that a little bit?
Yes, happy to. There will be two major proposals on our August primary election coming up here in Missouri in 4 weeks. I'll mention that I think you probably want me to touch on is what is Amendment 5, and that is the constitutional proposal. Voters will decide on that the legislature passed and put forward for them to vote yes or no if they want to put this in the Constitution, which is to eliminate the Missouri state income tax. A part of eliminating that state income tax and with revenues being lost, it would authorize the legislature to raise taxes, sales tax, use taxes, property taxes, that they currently don't have that ability and are constitutionally prohibited from doing so. So it's an interesting political dynamic. The voter in Missouri, I think back in the 80s, passed something called the Hancock Amendment. It took away the legislature's ability to raise taxes without voter approval. So that would essentially eliminate that. And, a lot of people think those revenues being lost and not being replaced would create some fundamental challenges across state government. We talked about some of those issues that would be very harmful. And this change occurring, a lot of people believe would make this even more challenging. Whether it passes or fails, you've got a lot of special interests on both sides of the issue that are out there campaigning pretty hard against it. You've got your traditional public education advocates out against it pretty hard and significant. You've got the Missouri Realtors Association, which is one of the powerful grassroots organizations in the state of Missouri that has pretty good political juice out there against it. And you've got tens of millions of dollars being spent by the Rex Singfield operation here in the state of Missouri, who's wanted this tax policy change for a long time to make Missouri look like Tennessee or whatever other states you look to that got rid of their state income tax. So the hard work, if this does pass, will still be yet to come on essentially rewriting the tax code and allowing politicians to raise taxes on you. Name whatever sales or services they would have to raise taxes on or what that looks like. But it'll be quite the experience, I think, if voters do pass that and the legislature will then have to do on the next steps of making that function. The other amendment that I probably want to hear about is Amendment 4, which would change the approval process of initiative petitions that are brought forward by citizens. It will remain the same for when politicians and the legislature puts a constitutional amendment forward that voters decide on. It's just a simple majority of everybody that votes in the state of Missouri for that election, and you can change the Constitution. But if it is brought forward via the initiative petition route, you have to have a majority of votes in each of our congressional districts, which probably makes it pretty darn near impossible to ever change the Constitution via that initiative petition route ever again, unless something is so obvious and it is so dramatic. But some of these other issues that I think the big thing is the legislature has failed to act and ignore block some of these issues over the years that the initiative petition route was taken to go around the legislature. Majority of Missouri voters supported it and got those policies implemented. That would go away. And there's a lot of special interest money in both sides of that issue being spent right now, and see where that falls beyond this primary election stuff.
Yeah, we'll definitely be tuning in for that. That was how Medicaid expansion was adopted. That was how the minimum wage was increased in Missouri. So clearly, it definitely removes kind of that direct democracy piece in terms of majority rule, gives a lot of power to a very small group. And just going back to the tax measure, I'll put on my old city lobbyist hat. And we talked a lot back in the day about kind of the three-legged stool when it comes to funding government. Property tax, income tax, sales tax. You take one of those off the table, and I think there's an assumption that suddenly the tax asking goes down, but it doesn't. It just makes you more dependent on those other sources. I think particularly with sales tax, everyone's paying the same amount on whatever good they might purchase. And so that truly would be a shift in tax burden for Missouri residents without any guarantee that you'll be getting the services that you were prior to that going into effect. Would encourage everybody, make sure you're registered to vote and make your opinion known on these issues. Sean, so we do have an unusual issue in Kansas. As I mentioned, we don't generally see a ballot initiative unless the legislature wants to put something on the ballot that would change the Constitution in Kansas. And that's what we're looking at right now with changing how we select the Kansas Supreme Court, which could have huge impacts across the state. Can you kind of talk about what we have now in place for court selection and what this would do if adopted?
Right now, as far as the Supreme Court goes, there's a selection committee made up of non-lawyers and attorneys from each of the 4 congressional districts. And that committee puts forth 3 potential justice candidates for the governor, and then the governor selects out of that 3. So they have to have certain qualifications, and then they go through that panel, and it attempts to remove as much politics out of the third branch of government as possible. Because if you think about it, we have direct votes for the other 2 branches of government, the executive and the legislative branches. This is the only one that you don't. And so they have that process. And then there is the retention election. So, and I don't even know how often it is with Supreme Court justices. I think it's every 4 years. I'd have to look that one up. But they have to stand for a retention election. So if there were misconduct, there's the option for impeachment through the other branches, which is very unlikely to happen. But if there were issues with their conduct on the bench, then they could be removed by the voters through the retention elections. And there has been attempts made on that, and I haven't looked up to see how successful those have been in the past. That's what we have right now. This would be a direct voting for Supreme Court justices by the voters. And I think the primary concern with that is that, they would have to raise money. So justices right now, you wouldn't have to do that kind of thing. Somebody funds these campaigns, a variety of interest groups and whatever else. And so to get your message out there, you have to raise money to win an election. So then you have kind of that third branch of government potentially beholden to donors, or at least sort of leaning to their interest in some way. So that's the issue. So you have business community. They've had some issues. There's been some various health-related issues. There's been some disagreements on decisions that have come out of the Supreme Court. And I think that's kind of where this is coming from. It is going to be a very expensive election that's going to be on the August primary. I think both sides are planning on spending into the tens of millions of dollars kind of thing, advertising statewide, and it has potentially very profound outcomes at stake.
Well, and I would even drill down a little further. This is really about abortion rights and public school funding. That's what this comes down to. It's some policy disagreements where the court has ruled contrary to what the majority of the legislature wanted. And it's interesting, though, because if you look at the ads, neither side is really referencing those 2 policy issues. It's more about the process of selection, but that'll be extremely interesting to see how that turns out in the end. And as you mentioned, that is on the August primary. And August primaries tend to be not really well attended. So tends to be by design that things are put on that ballot rather than in November at the general election. So we'll see how this plays out. There are other issues that we could talk about, but I know we're short on time here. So I just want to wrap up. And it has been an incredibly exciting session in both states, sometimes for good, sometimes not. But I feel like we are still continuing to move in the right direction when it comes to maternal and infant health in both states. And I'm going to give each of you an opportunity just to kind of speak to the importance of nonprofits being in that process. I feel like because I came from that background, it just tends to be second nature that I think it's beneficial, but I think for any listeners, it would be helpful to hear from those who are in the building every day, kind of what they see and why that's important. So, Chris, can you speak to that?
Sure. I think a couple things. You can't just assume anybody's going to do it for you. And so you've got to get active on issues that are important for your organization. And it's one thing to be able to talk to a legislator and whatever the issue is, get their support where they get to a place and feel comfortable and communicate that, yeah, I get that issue. It's kind of the next level when you've got to push for a change if it's of significant need to be able to get that done, where it's not just, hey, we need to vote for this. We need you to be here at this time and make sure that it gets supporting committee and it really bolster that effort. And, you can't do that if you yourself or you don't have somebody in the legislature on a daily basis making sure that each step is being taken to get that change needed for the sport, sort of to stop something bad from happening that affects the interest that your organization provides those services for those that are in your community. And I just think it's extremely important to be able to communicate that, and you just got to be engaged in that.
Well, and I think just to be a trusted entity, which comes from being a known entity within that process, is so very important. And that's why it's so important to have someone who is in that state house every day with those relationships, being able to give our position on any given issue. Sean, what about you, having been on both sides of this now as a legislator and then as a lobbyist? What do you think would benefit nonprofits?
What would benefit them is being as present as humanly possible. And the reason I would say that, I was first elected, I was 27 years old. So I was ignorant of much of the world and, still am ignorant of things outside of my purview, right? And these are very much citizen legislatures. They are experts at the things that they know. And without folks being there pretty routinely, but also bringing this sort of expertise that the individual nonprofit has, it's not that legislators are against you or with you or this or that. A lot of your issues and the things that come up and around, it's just darkness. They're just unaware. And so that ability to kind of communicate that, educate them, and bring them along, otherwise just doesn't happen because they don't know what they don't know. And once you have that opportunity to kind of explain it, you can bring folks along relatively quickly. And you already had them for a lot of the things we do. It's not like mamas and babies are unpopular. It's that they just aren't thinking about those issues until we bring them forward.
No, I think that's an excellent point. Just that awareness of the issues and us making it a priority and putting it on the radar is always important. Well, that is all we have time for today. Thanks to both of you. It's really been a pleasure working with you both through these sessions, and I look forward to what we'll do going forward. And for anyone listening, we do have our laws of interest up on the members only page of our website at www.nurturekc.org. Thank you for listening.